Good afternoon, everyone. It's great to have a chance to join this wonderful opportunity today to meet and talk about child survival. I want to particularly recognize two of my fellow ministers, Minister Azad of India and Minister Tedros of Ethiopia, who are co-conveners of this call to action. I know I have a number of other colleagues in the room who serve with me as health ministers, and in just a short time, we're also going to be joined by the executive director of UNICEF, Anthony Lake. It's certainly wonderful to be with you today as we approach the end of this terrific day, a day of learning dedicated to ensuring that every child, no matter where in the world he's born, gets a healthy and secure start in life. Today, each of us has an opportunity to assure that every child can celebrate her 5th birthday. Already, our work as individual nations and in partnership has driven childhood mortality steadily down over the last 20 years. By focusing on the biggest threats to child survival, we've reduced child deaths by 2 million a year between 2000 and 2010. 2 million a year. This is one of the greatest and yet least heralded triumphs the global health community has ever had. And I am so glad it's finally being celebrated. But it's not enough. Not for me, not for any of us. Now is the moment to take those achievements to the next level. Our efforts together can save millions more children and keep countless families whole. And among them are the world's next generation of great doctors, inventors, teachers, probably a few health ministers. Now, these are steps that each of our countries can take on our own to make it happen. Here in the US, we've seen our infant mortality rates decline steadily. This is thanks to the cooperation between federal and local governments, community and faith-based organizations, and the private sector. But today, we still lose far too many children in their first years of life here in the United States. They're gone before they learn to walk or talk, before they throw a ball or give their first smile. So the United States government has committed to protecting the health of our children with targeted interventions, serving populations who need them the most. We focused on reducing the number of preterm births. And we've set a national goal, very similar to the kinds of goals being set here today, to bring the percentage of all preterm births down to about 11% by 2020. Now, to reach that goal, we've just launched a nationwide public-private partnership to raise awareness about bringing pregnancies to full term. We've taken a family-oriented approach that educates women and their doctors on the dangers of premature birth. And we're funding innovative strategies like maternity medical homes, where pregnant mothers receive coordinated care from psychological support to education on how to care for their infants. And we've learned that seemingly simple interventions can reduce preterm births among women at the greatest risk for poor pregnancy outcomes. And where infant mortality has taken the highest toll in the US, we're partnering with state officials to create strategies and interventions to begin bringing these rates down. Our plan is to find out what works and scale up the best interventions to the national level. And today I'm pleased to announce that our Department of Health and Human Services will be collaborating in the next year to create our nation's first ever national strategy to address infant mortality. Now I know, yes, and that's a big step forward. I know many of you in this room have led innovative programs and initiatives like this in your own countries. But our best chance to solve these challenges is by working together. Now, I've been struck in my travels around the world that when we're talking about trade or foreign policy, there are often areas of strong disagreement among our nations. But when the discussion turns to tackling our biggest health challenges, particularly the health of our children, there's a broad consensus that we all must work together. I've seen the successes of these partnerships with my own eyes. In January, I was in New Delhi and helped to administer polio vaccine at a local vaccination site, part of a network of health centers that help vaccinate millions of children against polio each year. The day we were there, January 13th, 2012, marked 1 full year since the last reported case of polio in India. Amazing day for India. The government committed the funds, time, and hard work to beat the disease. But the occasion also showed the importance of partnership. Polio eradication efforts brought together not just our agencies with the Centers for Disease Control and the USAID, brought together other nations like Japan and Norway. Also, the Global Polio Eradication Initiative included Rotary International and the Gates Foundation, and multilateral organizations led by Margaret Chan, like the World Health Organization and Tony Lake's UNICEF. It showed us what we can accomplish when we all work together toward a common goal. Now, while HHS is primarily a domestic agency, what we know is protecting the health of the American people requires both working within and outside our borders. For over 50 years, we've engaged abroad on issues from basic research to vaccination programs, and we've worked together to extend these life-saving programs to those who need them most. Everyone here recognizes that collaboration can raise up all of our nations. The health of the world's children is not a zero-sum game. Working together, we've already accomplished a great deal. But we also know that one preventable child death is one too many. Today we have the tools and momentum to take that next step and drastically reduce child mortality around the world. Our nations owe our children the opportunity to grow up and become contributing members of their own communities. And thanks to our partnership, we can imagine a world where every child, no matter where she is born, will have that chance. Each of us will leave here this week with renewed commitment and dedication to make this possible, and we're eager to be good partners in this effort. Thank you all so very much.